Yeah. Again, excellent question. I certainly understand why the schools have closed. We heard that Visalia Unified School District was likely to close last Friday. We got word last Friday that Monday of this week they were going to close. So that did immediately cause concerns. You know, many of our nurses, many of our physicians have children that are in school, and we were very concerned that come Monday they're going to start calling in, not able to come into work because they looked to the school to be a good part of their daycare until they got off shift. But incredibly, that did not happen. I don't think we had any employees that called in because of that. They had made arrangements, fortunately with family, friends, other daycare options. We did spring into action. Our incredible human resources department and staff immediately started reaching out to different avenues throughout the community. They actually reached out to, as you can imagine, we now have a lot of high school kids that do babysit, but they're out of school now. And so enlisting them to earn a little extra money during this time period. So right now, daycare doesn't seem to be an issue. We have had as many employees that don't need to be here that can work effectively from home. We have about 150 employees that are now working from home that are able to do their jobs there. We definitely, we're trying to keep as much distance. We're canceling most all meetings, keeping employees away from one another, doing so many of our meetings now virtually. But at this point, we do not have any shortages of staff. One of the things that we have done, and again, this is coming at the recommendations of the CDC, and we're hearing it from a lot of other hospitals, we are canceling a lot of elective procedures. So elective surgeries where the surgery can be delayed or postponed without causing any harm to the patient from that delay, and we let the surgeon and the patient make those decisions. A lot of types of procedures, screening, colonoscopies, normal things that are done just in the course of annual preventative care that can be delayed. We've had patients that, we're going to get a CT or an MRI for a bad knee or a hip or something that are saying, I can wait. A lot of those are being canceled, which actually is now freeing up staff to come work in other areas. You may saw that we closed the Lifestyle Center just a couple days ago. We have about 20 employees that we want to continue to keep employed, continue to be able to put food on the table and take care of their families, and so redeploying them to areas that don't require a clinician to be there, but they certainly can lend a helping hand. So
and that would lead right into the labor pool. Do you want to kind of explain what our labor pool is?
Yeah. So right now we're calling this kind of a soft disaster. So we actually there's a national Hospital Emergency Incident Command System, or HICS, that was developed a number of years ago that all hospitals across the country follow in the event of a disaster. So if there ever was a major disaster, a school bus crash, a car pileup, we will then call a code triage, and we will immediately institute the Incident Command Center, which we have put up, the Incident Command Center, but we also immediately will institute the labor resource pool. And that generally is a physical space. A lot of times we use the cafeteria where literally all employees that can leave their jobs temporarily to come to that resource pool to be available to do any job that we need them to do. So we haven't declared this yet a disaster. We're managing it kind of on a softer level, but we've created what we call a virtual labor pool. So every day we're reaching out to people in finance, human resources, ISS, Those that can temporarily come out of their regular jobs to do things that are necessary in the medical center to respond to the virus, we do that every day. So.